morning, teachers. Today we have the pleasure to present to you our video speech about human defense against disease, especially two diseases that are the Still's disease and the HIV.
Introduction. The immune system defends the body against the invasion of foreign or dangerous substances. Such invaders can be microorganisms, commonly called germs, like bacteria, viruses, and fungi, parasites like worms, cancer cells, organs, and transplant tissues.
Okay, the Still's disease. The Still's disease is a multisystemic inflammatory process of unknown cause, characterized by daily episodes of fever, rash, arthralgia, arthritis, and myalgia. It takes its name from the English pediatrician George Still, who described juvenile rheumatoid arthritis as it occurs similarly but in adults.
Causes. Some researchers suspect that the condition is triggered by a viral or bacterial infection. Symptoms. Fever. You may have a fever of 38 Celsius every day for a week or more. A skin rash. A salmon pink rash may occur and will disappear along with the fever. Painful, swollen joints. Joints, especially the knees and wrists, may become stiff, painful, or become inflamed. And muscle pain. Muscle pain usually fluctuates with fever, but they pain may sever or interrupt them on daily access. Treatment. Non-steroidal anti-inflammatory drugs. Over-the-counter NSAIDs, such as ibuprofen, Aleve, can help relieve inflammation and mild joint pain. Steroids. Most people who have Still's disease need a treatment with drugs that have steroids such as prednisone, which is said to be most severe or stronger cases.
How does this affect other systems? Adult Still's disease is a type of arthritis characterized by high fevers and a salmon-colored rash. In addition to the inflammation of the joints, there is a rash of internal organs. It usually begins with symptoms of a systemic disease through all the body, including extreme fatigue accompanied by high fever. And there is also a mild salmon-colored rash that comes and goes with fever and does not cause itching. Lack of appetite, nausea, and weight loss are common. There may also be inflammation of the lymph nodes and enlarged spleen and liver, and a sore throat. Some patients develop inflammation around the heart and the lungs, and our fluids are commonly around the heart and the lungs. In general, it affects the lymphatic, circulatory, and digestive system.
Okay, relationship with topics of the trimester. After knowing how this disease works, we realized that the topic we gave this quarter are homeostasis, due to the intermittent fever that causes this disease and that is clearly related to the immune system. HIV, SIDA. HIV stands for Human Immunodeficiency Virus. It is a virus that destroys certain cells of the immune system. The body's defense against disease that help us stay healthy. HIV is the cause of AIDS. AIDS is an acronym that stands for Acquired Immunodeficiency Syndrome. HIV and AIDS are not the same. People with HIV don't always have an AIDS.
Causes. People transmit HIV through bloody fluids, including blood, semen, vaginal secretion, and breast milk. Symptoms: headache, low fever, sore throat, canker scars, rashes, and swollen, lymphy nodes. Treatment. Currently, there is no cure able for HIV or AIDS. Emergency pills or post-exposure prophylaxis treatment or HIV. This medication can stop the infection. Other name is TPP, protease inhibitors. Protease is an enzyme that HIV needs to reproduce. Entry inhibitors. Entry inhibitors prevent HIV from entering T cells. Without access to these cells, HIV cannot reproduce.
It affects other systems. HIV not only affects the immune system, viruses and medications you take as part of the treatment can also affect the body. It affects the vision, the bones, the heart, the kidneys, the liver, and the nervous system. Because HIV affects the immune system, the body becomes inflamed as it tries to fight infection, a process similar to simmering. This type of inflammation is related to a heart disease. If you have advanced HIV, you are more likely to get infections that cause inflammation of the brain and spine. This can lead to confusion and reasoning difficulties, as well as weakness, headaches, seizures, and balance problems.
Relationship with topic of the trimester. As we already know, this disease is acquired autoimmune. The immune system is the body's natural defense system. Protects you against infection and disease. It is made of many different cells that work together to find and destroy viruses, bacteria, and other germs that cause infection and disease. White blood cells, also called CD4 T cells, are important cells to the immune system that help coordinate your immune system.
Conclusion. In conclusion, we have that the immune system is an autonomous mechanism that every living being has from the beginning of life. It is a very complex network of cells and chemical substances that protects the body from pathogenic microbial agents, toxins, foreign particles, tumor cells, and autoimmune process. However, certain diseases, such as those already mentioned, can be quite challenging since there is no cure, and in order to balance the organism or do everything possible to delay death, certain types of treatment must be submitted. That is, there must be intervention external to achieve any possible cure.
Thanks.
Thanks.